Hello and welcome. Today we're diving deep into a condition called hyperuricemia-induced nephropathy, a kidney disease resulting from elevated levels of uric acid in the blood. We'll explore what causes it, how it affects the kidneys, its symptoms, and importantly, how it's managed and prevented. Let's embark on this informative journey to understand this complex condition. So, what exactly causes hyperuricemia, the foundation of this nephropathy? It's essentially an imbalance between uric acid production and excretion. There are several contributing factors. Increased uric acid production can stem from a diet high in purines, found in foods like red meat, seafood, and organ meats, or from increased cell turnover, which can occur in conditions like leukemia or certain cancers undergoing treatment. Reduced uric acid excretion, the other side of the equation, is often due to kidney dysfunction. This can be caused by conditions like chronic kidney disease, certain medications like diuretics, or even genetic predispositions. Understanding these varied etiologies is key to addressing and managing the condition effectively. Now let's delve into the pathophysiology, how hyperuricemia actually damages the kidneys. The key player here is uric acid crystal formation. When uric acid levels are chronically elevated, these crystals can precipitate in the kidney tubules and the interstitial spaces, the areas between the tubules. This crystal deposition triggers inflammation and damage to the kidney tissue. Over time, this leads to fibrosis, or scarring, which impairs the kidney's ability to filter waste and regulate fluid balance. This progressive damage can eventually lead to chronic kidney disease, and in severe cases, kidney failure. In acute cases, rapid uric acid crystal deposition can cause acute kidney injury, a sudden and severe decline in kidney function. Understanding the epidemiology, or the prevalence and distribution, of hyperuricemia-induced nephropathy is crucial for public health efforts. Hyperuricemia itself is quite common, affecting a significant portion of the adult population, particularly men and older individuals. However, not everyone with hyperuricemia develops kidney disease. The risk of nephropathy is influenced by factors like the degree of hyperuricemia, the presence of other kidney diseases, high blood pressure, diabetes, and genetic factors. Certain populations, such as those with metabolic syndrome or specific genetic predispositions, are at a higher risk. Understanding these risk factors allows for targeted screening and early intervention strategies. What are the signs and symptoms that might indicate hyperuricemia-induced nephropathy? Unfortunately, in the early stages, it's often asymptomatic, meaning there are no noticeable symptoms. This is why regular check-ups are so important, especially for individuals at risk. As the kidney damage progresses, symptoms of chronic kidney disease may develop. These can include fatigue, swelling in the ankles and feet, changes in urination frequency or amount, high blood pressure, and even foamy urine, which is a sign of protein in the urine. In cases of acute uric acid nephropathy, symptoms like flank pain, nausea, vomiting, and a sudden decrease in urine output may occur. It's important to note that these symptoms can also be associated with other kidney conditions, so a proper diagnosis is crucial. Diagnosis of hyperuricemia-induced nephropathy involves a combination of blood tests, urine tests, and imaging studies. Blood tests are used to measure uric acid levels, as well as kidney function indicators like creatinine and blood urea nitrogen sabinin. Urine tests can detect protein in the urine, which is a sign of kidney damage, and may also reveal uric acid crystals. Imaging studies, such as ultrasound or CT scans, can help visualize the kidneys and detect any structural abnormalities or uric acid crystal deposits. In some cases, a kidney biopsy may be necessary to confirm the diagnosis and assess the extent of kidney damage. While there aren't distinct types of hyperuricemia-induced nephropathy in the same way as some other diseases, it can be broadly categorized based on its presentation: acute and chronic. Acute uric acid nephropathy involves a sudden and severe decline in kidney function due to rapid uric acid crystal deposition, often seen in tumor lysis syndrome. Chronic uric acid nephropathy develops gradually over time due to long-standing hyperuricemia and chronic crystal deposition. The distinction is important as the treatment approaches and potential outcomes may differ. Treatment and management of hyperuricemia-induced nephropathy focuses on lowering uric acid levels and protecting kidney function. Medications that reduce uric acid production, such as allopurinol or febuxostat, are often prescribed. Uricosuric medications, which increase uric acid excretion, may also be used, but they need to be used with caution, especially in patients with pre-existing kidney disease. Dietary modifications, such as limiting purine-rich food, are also important. In addition, managing other risk factors like high blood pressure and diabetes is crucial. For acute uric acid nephropathy, intravenous fluids and medications to alkalinize the urine may be necessary to dissolve uric acid crystals and protect the kidneys. In severe cases of kidney failure, dialysis may be required. Prevention is always better than cure. Several strategies can help prevent hyperuricemia-induced nephropathy, particularly in individuals at risk. These include maintaining a healthy weight, following a balanced diet low in purines, staying well hydrated, and limiting alcohol consumption, especially beer. Regular exercise and managing underlying conditions like high blood pressure and diabetes are also crucial. For individuals taking medications that can increase uric acid levels, close monitoring and potential adjustments to the medication regimen may be necessary. Early detection of hyperuricemia and prompt treatment can significantly reduce the risk of kidney damage. The prognosis for hyperuricemia-induced nephropathy depends on several factors, including the severity of kidney damage at the time of diagnosis, the effectiveness of treatment in lowering uric acid levels, and the presence of other medical conditions. Early diagnosis and treatment can often slow or even halt the progression of kidney disease. However, if left untreated, it can lead to chronic kidney disease, kidney failure, and the need for dialysis or kidney transplantation. Recent research is focusing on developing new medications that are more effective at lowering uric acid levels and protecting kidney function. Studies are also investigating the role of inflammation in the pathogenesis of the disease and exploring potential therapeutic targets to reduce inflammation and prevent kidney damage. Advances in early detection and treatment strategies offer hope for improved outcomes for individuals with this condition.